Sitting cross-legged is something many of us could do easily when we were younger. However, as we age, it becomes more difficult and sometimes impossible.
That's right. And actually, we're going to go through and tell you why this happens, and more importantly, the benefits of being able to do it in regards to the health of your hips and legs.
Bob and Brad, the two most famous physical therapists on the internet.
Welcome to the Bob and Brad channel. We are the most famous physical therapist team on the internet.
In our opinion, of course, and our goal is to get you to stay healthy, fit, and be pain-free. And if you're new to our channel and happen to like this video, please subscribe.
Yeah, please subscribe. There you go. What are we going to talk about exactly? The cross-legged position on the hips?
Yeah, so now this can affect anyone when you're trying to sit like that, or if you're just trying to cross your legs for simple tasks like putting on your socks, shoes, trimming your toenails, whatever it may be, especially as we age. So some things that can be a factor limiting this first is hip stiffness. Obviously, you have to have a lot of hip rotation and mobility to get your leg up here and rotate out like that. Some things like arthritis can also affect this, but that can be your hip joint or your knee joint as well, even your back. These can be limiting factors. So you could have tight muscles in your hip rotators, your lumbar spine, low back, your hamstrings may be tight, adductors, abductors, any of these areas can limit this or even just knee pain in general. And another common factor is sitting in chairs. If you're always in this position, you are kind of stuck in that position for prolonged periods of time. It's going to get things tight if you never move beyond laying flat, standing, or sitting.
That's right. That was a very comprehensive explanation. Nice job, Mike. So the big picture is, can you do this? You want to keep your joint healthy and free from arthritis? These exercises can help.
So first we're going to show a few stretches you can try, and then we're going to go into some strengthening exercises as well. Most of these are going to focus on the hip because that is the big contributor allowing you to do this motion in both legs. So for beginners, what you can do if you are really tight and you can't even lift your ankle up here and it's just hurting too much, actually start lying down on your back. So once you're on your back, what you can try and do is just a simple butterfly stretch. So bring your feet up, touch the bottom of your feet, and then try to let your hips pop out to the side like this. If you're really tight, you're going to be higher up here. If you start to loosen up over time, you'll be able to get them down closer to the mat. You could do this on the floor if you're comfortable, but if you're not comfortable on the floor, you can do it on a bed. If this is really problematic for you, then just do one leg straight and then work on one side at a time, because sometimes people are able to get a little more stretch. You could see I'm a little deeper now. I could touch the mat just one side. So.
There you go. All right. So that's a great option. You can do it in bed before you get up. Or maybe you said that.
I kind of said it. Anyway, the next stretch we can do is called a figure 4. Now, if you're really tight again, if I'm stretching my right leg, you just put it over your shin like this, and maybe that's all you can do. Work on bringing it up above your knee over time. Once you can get here comfortably, this may take a few weeks, or maybe you can do it right away. Try bending this knee up, and you're going to get more of a stretch, and then push down and work on that rotation. This part can be tight on a lot of people. They'll look like this, and then just work on pushing down, trying to breathe and relax. With most of these stretches, you can try 15-30 seconds. If you're feeling comfortable and want to just hang out here for a while, you can do it for a minute. Just do them a couple times a day, but make sure you're working on both sides. And you may notice one side is tighter than the other, so just spend a little more time on that side. And I know we're going to get questions about, can I do this if I had a hip replacement? If you are past your precaution phase and your physician says it is fine to do, you can do them. If they didn't give you the okay to do this, then don't do it.
Yeah, and as far as that go, if these create any pain, any sharp pain, you don't want to do it. Even if it's a little pain, it should just feel like a stretch pain. That it's not one of those things that makes you go, oh, I'm hurting myself. If anything negative like that comes up, do not do it so aggressive, or just simply don't do it. Don't do it. It should feel reasonably good while you do it, and afterwards should continue to feel good. Sometimes you stretch something new. It doesn't hurt that much while you do it, but 3 hours later, it's like, holy cow, something is painful. That is what we're not looking for. Mike, I just want to give one suggestion for people who are real tight and when your leg is down. Let's say this is as far as you can get, maybe even that far. If you want to take a belt like this that you can put a loop on and then put that around your ankle, and it gives you something to grab onto so you can get a little more stretch. It just makes it a little easier, and this is something that can be done. We'll demonstrate this in the seated position.
The last stretch I want to show is to stretch your low back and your buttock region a little bit, because sometimes when people are sitting cross-legged, if you have a really tight back, you might get really forward rounded like this. So what we want to do is to just bring your knees to your chest. You can do one leg at a time. If you are really tight, leave the other leg straight. If you have really tight hip flexors, this leg's going to want to bend up. So try to keep it straight and stretch for about 30 seconds. Do the other side. If you feel like you have good mobility, this doesn't bother you, and you want to save time, you can certainly do both at once. But again, if you really struggle to reach with this, you can use some sort of belt or stretch strap like Brad has there. Do you want to show how to use that?
Oh, yeah. Okay, let's go down on the floor. If you're able to do these on the floor, it's probably a little bit better. Just getting down and up and down off the floor is a good exercise as long as you feel safe. This is one I start with all the time. Do this on a regular basis. If you can use a belt, I'll show you. There's a big advantage. I mean, this works okay if you have good hand strength. Go back like this, and I'm pulling my feet towards me. My elbows are inside my knees, and this gives me a nice stretch. I actually have one of these at home. It's called a stretch out strap. The big advantage of these is these loops, about every 6 inches. It allows you to not have to grab on with finger strength, but put it on your wrists. See, my fingers are not doing anything. If you have arthritis in your hands and fingers, this is a big advantage. And look at that. Oh, this is just, feels great for me. I really like this stretch. The other stretch that I'm going to show you that's a little bit off.
I'm quite surprised you haven't mentioned your socks yet.
Oh, well, these are my socks. These are the right, it says R. That's a big advantage.
He likes to show them off. He likes those socks.
Now this, hamstring, adductors, and we're getting the hip capsule. I can work this. So just for people who want to have a little advantage and have finger problems and grip problems, the stretch out strap is really a nice deal. And they're not very expensive either.
Now, another important thing to look at is your hip strength in general, because sometimes that can be a limiting factor as well with crossing your legs. So having the flexibility first, which we showed, is important, obviously. And then strengthening is, I would say, equally important. So an exercise most people can do, we're going to start, is the glute bridge. Just lay on your back like this. Am I saying that right? Lay or lie? I don't know. Lie, sorry.
Yes, there are going to be English majors that will be paying attention, and they'll help us out by nice comments.
I've watched a few old videos, and I remember this. Anyway, so we're going to do bridging, bend. Both knees, feet flat on the ground. You don't have to have shoes on if you don't want to. You're going to engage your glutes, squeeze your butt cheeks together, engage your tummy muscles, your core. If you're new to this, put your hands at your side and try to lift up as far as you comfortably can, and then go back down. If you're really stiff or have back pain, some people can barely get their butt off the ground. That's okay. For beginners, just take your time. If you're not using any resistance, just hold it for 5 seconds at the top, and then come back down nice and slow. You can build up to 10 repetitions of this. You can do it for 2 to 3 sets. Just build it up gradually over time. If you're very weak and can only do 5, that's fine. Just keep working on it. Do them about every other day. So that's a good beginner exercise. You're getting a lot of low back flexibility, glute, hamstrings as well. So you're kind of getting a lot of different areas that are problematic with sitting cross-legged.
There you go. Yeah, that's a nice exercise. And we're going to show, this one is going to work more the
rotating muscles.
There you go.
So your hip rotators. So we're going into external rotation, bringing your feet out like this and then back down. My feet are staying together and my knees are coming apart like this. Go what motion feels good for you. If this feels way too easy and you have good mobility, you could take some sort of loop band like this. You can take a little TheraBand that's latex or latex-free ones, whatever you have available. If that seems way too simple, and you can do these with some resistance over time, this is going to really strengthen those hip external rotators. Just make sure you start with the easier band if you're new to this, because you'll probably be sore the next day, and then you'll be cussing at us about it. So start slow and progress over time. Do 2 to 3 sets of 10 repetitions on one side, and make sure you do it on the other side. And I'm gonna fall off the bed here.
Be careful, Mike.
And yeah, just go slow and easy with it. Boy, this band's kind of hard.
Yeah.
I'm not gonna lie.
These are elastic bands, and I like them because they're a little bit wider and they're more comfortable.
Do you want to show our last exercise, or do you just want me to keep talking?
Well, 3-way hip kicks.
Yeah.
Standing we're talking about?
We're talking standing. So we worked on the glute and the low back a little bit. First exercise, the rotators with that one. Now we're going to work on the hip flexors, abductors, and extenders. So you can do this in a standing position. You can hold onto a chair, countertop for support, go to a railing, whatever works for you. And first, what I like to do, is one leg. You can do them all at once if you want. Go forward, sideways, backwards, forward, sideways, backwards. Or if that feels too weird for you, you can just stick with going one direction for 10 reps, and then sideways for 10 reps. We're going to kick each other here.
Oh, no, I'm watching. I'm very attentive.
Just make sure you do 10 repetitions each direction, and make sure to do it on both legs. And then after that, you can do that a couple sets if you want and build up over time. And Brad is just doing every which way at once.
You have to be careful. Once I kicked my wife at home, and she was not grateful.
You're going to have to go to a countertop or something sideways, because obviously if it's in front of you, you're just going to kick it. So I thought that'd be pretty self-explanatory. But yeah, that's what you can do to strengthen your hips. So stretch them, strengthen them, try all the motions, stretches, and exercises. If something's harder, make sure to stick with it over time. People, personally, we've worked with in the clinics over the years, this mobility doesn't come back within a day. It's going to take some time, so you have to stay consistent with this. Make sure to at least do this routine 3 days a week if every day seems too troublesome. But just take your time with it, and it should improve and oftentimes causes less pain.
Absolutely. The world wasn't invented in a day. Same thing with your hips. So enjoy the day, be careful, and don't get too hippie. Get it? He's too young for that.
And if you want to check out another video on hip pain specifically, click the video on the screen.
5 hip pain tips, no meds, and no workout. What a deal.
Bob and Brad, the 2 most famous physical therapists on the internet.